Blackwell, and today I'm going to be doing a head-to-toe assessment checkup. So I'm just going to go ahead and get started. So I walked into the patient's room, I'm washing my hands. Hello, my name is Katie, and I'm going to be your nurse today, and we are going to do a head-to-toe assessment on you just to make sure everything's fine. But first of all, I just wanted to start off by checking your level of consciousness. Can you tell me your first and last name?
Lauren Haynes.
All right. Can you tell me what city you live in?
Hattiesburg.
Okay, and what is your birthday?
10/16/1992.
All right, that's great. So I'm just going to start off checking your head and looking at your hair and the texture and all of that. So it feels kind of thick, which is fine. I don't see any flakes or scales, so that's really good. That's normal, you shouldn't see that. Just going to check around to make sure everything's symmetric. And it feels fine, nice and hard, no soft spots where they don't need to be. I'm going to move on to your skin. It looks nice and consistent with your race. Everything on the face looks bilateral, meaning your eyebrows and your nose is in the center of your face, so that's good. And your eyes are bilateral, your eyelashes look good. Your skin looks nice and smooth. I'm just going to go ahead and feel around. Everything feels fine. I'm going to palpate your temporal pulses. They're nice and smooth. That's good. And even. All right, and I'm going to palpate your temporal lymph nodes, and a lot of times you can't palpate them. Okay, so now I'm going to check your ears. They're nice and smooth and soft, which is good. That's what we want. Can you hear this?
Mm-hmm.
All right, great. Okay, so next I'm just going to ask you to follow my pen light wherever it goes. Oh, well, first, actually, I'm going to just look at your sclera. It's nice and white. Your conjunctiva are nice and pink. That's what we want. Excuse me. All right. All right, great. That just shows your eyes have parallel movement. Now, what I want you to do is just look across the room and focus on a distant object. All right, now I'm just going to shine a pen light on the side of your eye. Okay, let me check the other eye. All right, now I'm going to ask you to look across the room again, and then after a couple seconds, I'm going to bring the pen light about 6 inches from your nose, and I want you to take your focus from across the room to the pen light.
Okay.
All right. All right, looks good. That basically just shows that your pupils are equal round and react to light and accommodation. So next, I'm just going to look up your nose just to make sure the mucosa is nice and pink. All right, everything looks good. Can you open your mouth for me? All right, no signs of cavities. It's nice and moist, so that's what we want. Your lips look fine. Can you move your jaw side to side? All right, that's good. Next, I'm going to, well, first let me just check your carotid artery. Okay. Good, and then I'm just going to check for your trachea to be midline. All right, and then I'm going to look for your lymph nodes. Okay. Everything looks good so far. Next, I'm just going to check for your temporal pulse, or your carotid pulse again. Oh, can you hold your breath for me? Right, thank you. Now I'm just going to ask you to lean your head over just a little bit. This is just to look for your jugular vein. Okay, so there was just a small pulsation, but no vein protruding, so that's good. Now we just check for skin turgor. This just shows you're not dehydrated, so that's good. Now I'm going to just assess your temperature. On your arms, you're nice and warm and normal. Brachial pulse is good. pulse is good, nice and smooth. Okay, now I'm just going to check your lung sounds. Okay. Right. Alright, and then just like one more. I think it's usually a little below. Alright, everything sounds good. There's no abnormal sounds. I'm going to ask you to just turn around so I can check your lung sounds on the back. Actually, could you turn? There we go. Thank you. Okay. Alright. Everything seems good. Now I'm just going to check your lung sounds from the lateral side. So if you could just turn back around, that'd be great. Thank you. Alright, so right here. Just stay right there. I'm going to check for your chest expansion on the back. So if you can, just take a deep breath for me. All right, great, thank you. The hands moved apart and there was bilateral chest expansion, so that's really good. And then if you could stand up really quickly, I'm just going to check your anterior, posterior, lateral. That's a 1-2 ratio, that's normal. Now I'm just going to check your heart sounds really quickly.
Do you want me to sit back down?
Oh yeah, you can
Okay.
sit back down. Sorry about that. Okay. Alright. So. Alright. Alright, and then just a little more. Okay, and then if you can lift your breast for me, and I'm going to check your apical pulse. Alright. And normally you would check the apical pulse for a full minute, and it should be between 60 and 100, and that's just listening for the S1 and S2 heart sound, but I forgot my watch. But that's what you would do, and then also you would assess for lifts or heaves or thrills. And that all seems to be normal. Okay? And so now can I get you to lay down on the bench for me? You come a little closer. Alright. And so now, Ms. Haynes, I'm just going to lift your shirt up and I'm just going to inspect your stomach just to make sure you have no lesions or anything like that. Do you have any pain or tenderness right now?
No.
No? Okay. So it looks fine. Now I'm just going to listen for your vowel sounds. I'm going to start in the upper left quadrant. Okay. Alright, everything sounds normal. Now I'm just going to check for vascular sounds. Alright, no vascular sounds were heard, and then the last thing I'm going to do is just palpate, and like I said, no vascular sounds were heard, and that's normal. And I did hear your vowel sounds, and they were very normal, so that's good. They weren't hyperactive or anything like that. Alright, thank you. Everything feels fine.
Great.
Alright, you can go ahead and sit up for me. Oh, I already checked your temperature, and it was nice and warm. I'm just going to check for blanching of the fingernails, and that's just basically showing that if they return white, you have good blood flow. So let me check over here too. Alright, good, nice, good temperature. Okay, and then can I have you just move your legs up here? Can I have you lay down again? I'm just going to, yeah, sorry. Alright, I'm going to flex your leg, and this is called a Homan sign. It's just to check if you have a clot. I'm going to flex your foot back, and if you have any pain, just let me know. Do you have any pain?
No.
Okay, I'm going to do the other one. Alright, and then you can go ahead and sit up again. And now I'm just going to check for your pulse, your posterior tibial pulse. Alright, everything feels normal. Alright, great. And so now I'm just going to have you stand up. We're just going to do a few little things. So I just want you to copy me. So can you do, okay, can you, and then forward. Okay, and then can you put your arms up and down, and can you extend your leg up, down? This is called abducting it, and then this is called adducting it. Okay, and then can I have you flex your toes apart? That's great. And then, well, one of the last things I want you to do is flex your toes. Sorry, I need you to, this is what's called a Romberg test, so you're going to stand and close your eyes for me.
Okay.
Alright, and this just shows your balance, so you have good balance, and then I want you to do two more things. Close your eyes again and stand on one foot. Alright, and then open your eyes again, and then stand on the other foot and close your eyes. Alright, great, your balance is good. And then one last thing is just walk like this. Alright, shows good balance and a normal gait. And this is the end of the checkoff.